Assalamualaikum and a very good morning to Associate Professor Dr. Yap and my fellow classmates. We are from Group 2, would like to present on our PBL output based on a rabies case entitled One Health Approach in Rabies Elimination in Malaysia. Our team members consist of me, Anis, Shafika, Aisha, Akila and Gayatri. Before I go deeper into the topic, here is an introduction to what rabies is. Rabies is a fatal but preventable type of zoonotic viral disease originated from mammals or rabid animals and often transmitted through the bite of a rabid animal. It can infect the central nervous system of mammals where the virus enters the brain and causes an inflammation. Rabies is caused by genus Lyssavirus virus, one of the animal viruses in Rhabdoviridae family with a distinct bullet shape. The rabies genome encodes for 5 types of proteins, namely nucleoprotein, phosphoprotein, metric protein, glycoprotein, and polymerase. There are 2 major structural components of Rhabdoviridae viruses, which are ribonucleoprotein pore and envelope. These are the steps involved in replication of rabies virus. To summarize the process, the virus attaches to the host cell membranes via the G protein, penetrates the cytoplasm by fusion or pinocytosis, and is uncoated to RNP, which is ribonucleoprotein core. The core initiates the primary transcription of the 5 complementary monocystronic messenger RNAs by using the virion-associated RNA-dependent RNA polymerase. Each RNA is then translated into an individual viral protein. After the viral proteins have been synthesized, replication of the genomic RNA continues with the synthesis of full-length positive-stranded RNA, which acts as a template for the production of progeny-negative stranded RNA. Symptoms manifestation of rabies depends on the incubation period, which defined as time between virus exposure until symptoms appear, which all of this happened after virus travels to the brain. It can last for weeks or even months. Among the early symptoms of rabies, including weakness or discomfort, fever or headache, there might also be a pricking or tingling sensation at wound site, and these symptoms may last for a few days. Symptoms can progress to cerebral dysfunction, anxiety or confusion, and agitation. As the disease progresses, the person may experience delirium, abnormal behavior, hallucinations, hydrophobia, which is fear of water, and also insomnia. For animals, the signs, symptoms, and outcome of rabies can vary, but the symptoms are often similar to those in humans. So how do we determine or know that an individual or animal has been infected with the disease? In animal, rabies is diagnosed using the direct fluorescent antibody DFA test. Meanwhile, in human, several tests are required before the diagnosis. Tests are performed on samples of saliva, serum, spinal fluid, and skin biopsies of hair follicles at the nape of the neck. Serum and spinal fluid are tested for antibodies to rabies virus. Skin biopsy specimens are examined for rabies antigen, while saliva can be tested by virus isolation or RT-PCR. This is a statistic of rabies cases in Malaysia. In Malaysia, the first rabies case was recorded as early as in 1884. And although Malaysia was free from the case from 1954 onwards, this disease has re-emerged in the country in 1993, after nearly 4 decades, and has been reported since then. In 1995, there was a report on 2 canine cases from dog bite in Terengganu. In 1997, there was 10 animal cases has been reported, 1 human case in 1998, and 1 canine case in the subsequent year. In 2013, World Animal Health Organization declared that Malaysia was freed from rabies. However, in 2015, there was 11 canine cases outbreak at Perlis, Kedah, and Penang coming from stray dogs from Thailand. From the picture, it can be clearly seen how serious the disease is when looking at the number of survival for each indicated year. Hence, it is proof that rabies is a pressuring One Health issues that needs to be diminished. From One Health concept, we know that human, animal, and environment health are interconnected. Therefore, it can be said that rabies is a One Health issue involving these 3 components. Rabies are often spread by the stray dogs. infected rabies move from the border town through the highway and then will infect the domestic animals. To make it worse, the construction of Pan-Borneo Highway, for example, and opening up land for oil palm plantations speed up the infection rate, as translocation of wildlife also happened due to their habitats being destroyed. This incident results in overpopulation of dogs, which further leads to the imbalance of ecosystem. Ultimately, the rabies-infected dogs will bite the humans and infect them. These are the One Health members involved in combating the rabies. In human health, we got medical doctors, who are the first member to be contacted when a person have a contact with any wildlife or unfamiliar animals, particularly if have been bitten or scratched. There are also nurses, virologists, epidemiologists, and lab technicians involved. In animal health, there are veterinarians, veterinary technologists, and animal control agencies. These people are responsible in giving rabies vaccination to pets, spay or neuter the pets, or even give an oral vaccination for wildlife, which is by giving the vaccine by mixing in their food, as wildlife are hard to approach and handle. In the environment sector, there are wildlife control or rescue organizations and environmentalists, and not to forget the other sectors involved, such as government, NGOs, policymakers, social scientists, private sectors, community, pet owners, veterinary research institute, and also other researchers on human health. So these are the respective roles of each One Health members that has been mentioned. First, we have human health sector, who are responsible in pre and post exposure treatments, diagnosis, recording and reporting of cases. We also have animal health sector, which in charge for dog mass vaccination, euthanasia of rabid animal, and also animal birth control. In wildlife sector, they are in control of active surveillance, epidemiological investigations of rabies cases, reducing rabies spillover from wildlife to domestic animals or humans, and maintaining and controlling the wildlife population management. As for the government, they are in charge of legalizing dog and pet vaccination, surveillance for rabies cases in country, and also provide funding to support the rabies control initiatives. For diagnostic laboratory, they are responsible in conducting tests to verify rabies cases in both animals and humans. And for the other sectors, they are needed for public awareness and also helps in develop research project and study. Making an effort to combat the rabies, it is important for the individuals or groups involved to be competent enough. Among numerous One Health competencies existed, these are a few that we have identified to be vital in managing rabies. First is communication and informatics. Communication aids in early identification of rabies cases in humans and animals, as rapid reporting of suspected cases to health authorities and veterinarians is essential for prompt intervention. By communicating effectively with one another and share data and reports of rabies cases, it can provide better understanding of the disease dynamics. Meanwhile, informatics also help in monitoring the progress of rabies control programs by collecting data of vaccination rates, illness occurrence, and the success of interventions. Update on progress can also be shared via communication with public and stakeholders, showcasing the results of control efforts and preserving support for continuing projects. As different sectors involved in managing rabies, collaboration is indeed inevitable. It can provide comprehensive surveillance of rabies cases. Collaborative research efforts can lead to innovative solutions for rabies control, including improved vaccines, diagnostic tools, and surveillance methods. In fact, intersectoral partnership benefits in providing education for veterinary services at rural areas and low-income pet owners, as well as helps in increasing the funds to support the rabies control programs. While carrying out this effort, it is important for the member to abide with the existing policies and regulations, as it helps in creating awareness about rabies, its transmission and prevention, as well educating the general public and medical professionals. Besides, it can also influence the development and enforcement of law on pet vaccination, responsible pet ownership, and the handling of stray animals that will improve animal welfare standard and thus reduces the risk of rabies transmission. Lastly, in every effort being done to overcome rabies, it is a must to know the associated culture's belief in the area, as ability to understand and respect other cultures will affect the attitude toward rabies. In Bali, for instance, it is found that dogs play an important role in daily lives of Balinese communities as they help with guarding the houses, be companions for people working in the fields or plantations, as well as their roles in religion or traditional ceremonies. Due to this, where there's a need for innovative ways to move forward with a rabies control program, the uniqueness of social and cultural context can become an opportunity to create control activities that involve the community in different ways. So in this case, it is recommended for a community-driven activities to continue and optimize the rabies control program.
Rabies monitoring. In surveillance system, disease notification is a very crucial part of our strategy. Let me show you how it works. First, notify all cases to the nearest district health office within 12 hours. Second, forward it to the nearest veterinary office for investigation and monitoring the outbreak. The office will examine and determine if it is confirmed or suspected of having rabies. Third is to inform the district health office and the state veterinary services department. They will then declare the area or state as rabies infected area. And fifth is to report the suspected and confirmed cases of rabies in human and animals to the Disease Control Division, Ministry of Health, within 24 hours of diagnosis. And lastly, the DCD will coordinate with Department of Veterinary Services for rabies prevention, control, and eradication measures. This is how we keep track of rabies and respond accordingly. What about zoning? When an area is declared as rabies-infected area, it includes all area within 10-kilometer radius from the case point, subjected to quarantine and movement restrictions to prevent further spread of rabies. Anyone who fails to comply will be fined 5,000 ringgit Malaysia and imprisoned for 3 years. Next is where the stakeholder can come in. The animal health sector can help with the stray dogs management, supplies vaccine, and provide supplies to the animal vet clinics, and the human health sector can help with diagnose and also provide prophylaxis. Continuous control and preventive measures. These are the actions to prevent and reduce the transmission of rabies in Malaysia in addition to rabies monitoring. The first one is the immune belt, which is a buffer zone created along the borders of Malaysia and its neighbouring countries such as Sarawak, Kalimantan, and Semenanjung Malaysia, Thailand. In this zone, we have enforced dog ownership licensing, vaccination obligations, and management of animals to create barrier of immunity against rabies. The second one is post-exposure prophylaxis. It includes injections, wound cleansing, and immunization. It is a life-saving treatment that we give to anyone who have been exposed, including healthcare workers who are at risk of exposure. The third measure is the public awareness program, which to educate people about rabies and its prevention using posters, radio, social media, which teach the preventive vaccination. We want people to know how to protect themselves and their pets from rabies. The last one is important, importation regulation, which is a requirement for any animal entering Malaysia to have valid health certificate and proof of vaccination to ensure that no infected animal are brought in our country that can pose threat to our people and wildlife. The border between them is the immune belt. It shows how we have implemented immune belt measure along our borders to block and protect rabies from Thailand and Kalimantan. Here, this is the story of how we have successfully eliminated rabies from Semenanjung, Malaysia previously. In 1945, there was a major outbreak in Wellesley, which is now known as Seberang Perai. This outbreak affected more than 2,000 people and caused 150 deaths. It was a serious public health crisis that prompted the establishment of national rabies committees to coordinate the control efforts. In 1954, compulsory vaccination of all dogs and rigorous euthanasia of stray dogs was decreed. It was effective in reducing the number of rabid dogs and breaking the transmission cycle of rabies. By 1960s, no human cases of rabies is reported. In recent years, there was various diagnostic tests developed. First is antibody test, direct immunohistochemical test, lateral flow of care test, which enable us to detect rabies cases quickly and accurately. Now, we are done with Semenanjung Malaysia. Now let's turn our attention to achievements in Sarawak. First, over 69,000 people have been reached through public awareness campaigns. Community leaders and the media have also been involved in the campaigns. Second, 110,000 dogs and about 8,000 cats have been vaccinated. All animals owners also have been required to have license and manage their animals properly. Free vaccines and supplies have been given to owners and the animal bite clinics. The third one is an immune belt along the border, which cooperation with authorities in Kalimantan have been established. And fourth, rabies vaccine have been successfully bought at a national price from the World Organization of Animal Health. It helped us secure enough vaccine and save costs. And lastly, special funding from the government and manpower support from various agencies and volunteers. Who involved in rabies elimination movements? Who leads? The main body that oversees rabies prevention and control activities among various agencies is the National Rabies Control Committee or NRCC, established by our government and consists of representatives from Ministry of Health, Department of Veterinary Services, Ministry of Housing and Local Government, and NGOs. The NRCC is responsible for planning, implementing, monitoring, declaring, and zoning rabies-infected area. Using stepwise approach towards rabies elimination, or we call SAR protocol, to develop a customized work plan. It provides score that indicates the progress of the assessed country towards achieving rabies elimination. Malaysia's latest score is 2.5, which was obtained in 2018, but it was not based on Malaysia's own self-evaluation, but by an external evaluation by other organizations. This means that Malaysia has not fully adopted or utilized the SAR tool to plan, monitor, and evaluate our control and elimination program. This is a call for us for improvement to be made. WHO has provided guides in rabies elimination strategy, which is through enhancement of 8 key components. Actually, this will be our benchmark and provide a clear view and goals on what to be improved systematically. Here, look at the components, issues in current approach in Malaysia, and its possible improvement. First, political commitment and leadership. Malaysia may have National Rabies Control Committee, but not our own National Strategy and Action Plan for Rabies Elimination, NAPRE, to properly oversee and coordinate rabies prevention. India has their own NAPRE. WHO outlines that it should have detailed information on vision, goals, objectives, activities, indicators, budget, timeline, responsibility of the stakeholders. Second, legislation and regulation. Existing laws and policies are outdated. All laws are enacted before Malaysia's independence, before emerging the re-emergence of the infectious disease, and also not in line with the challenges of the veterinary professions. Importantly, those acts did not adapt or comply to the One Health concepts in zoonotic diseases like rabies. And also our federal system of government. Each state has its own jurisdiction over animal welfare and health issues. Well, flexibility is necessary, but standardization is needed. If we look carefully, if in the moment we fully enforce these 2 strong key components, all other 6 components later can be regulated smoothly. Let's see. Look here. Inhumane, unsustainable, killing dogs, lack of access in rural and remote areas. Through 2 components mentioned previously, I'm sure we will find solution on dog relocation shelter, awareness on the responsible dog ownership, animal birth control programs in community, and better facilities like vaccination drive and also increase in laboratories. The last 3 components, education and communication, which hardly reach high-risk groups like children, farmers, hunters. Here, we emphasize using culturally appropriate message and increased awareness. The last 2, enhancing surveillance and monitoring, as well as research and innovation. In conclusion, today we face new challenge with the re-emergence of rabies cases in Malaysia. Through One Health approach, eliminating rabies means saving life and protecting biodiversity. Through improvement, we can achieve rabies-free status again and improve our resilience against other zoonotic diseases. Everyone, rabies elimination is a shared and collective goal. Commitments and collaboration of all stakeholders. Let us join the fight against rabies and make Malaysia a rabies-free country. Thank you for your attention.